thank you for being here. There are many places that you could be this evening, so we are grateful for the time and commitment you have made to be with us. As Cindy shared, I am just now hitting 6 months in my tenure with the Suburban Hospital team here. I am privileged, honored, proud to be with this team. Some of you I have met, and some of you I look forward to hopefully meeting soon in person, but I thought I would start this evening by sharing a little bit about my background, what brought me here to Suburban, and then a very brief overview of my first impressions, what I've seen in my first 6 months through my listening tour, through my observations, and through my own experiences here at Suburban Hospital. And then finally, where I hope our team will focus going forward in the coming months in service to all of you as our community members and our vested parties that are interested in how we achieve our mission here at Suburban Hospital. So first, coming here to Suburban Hospital and coming to Bethesda, for me, is a personal return to home. For those that I haven't met and haven't heard my story, I'm originally from this area. In fact, I was born in DC at Walter Reed when it was in DC. My mom was a nurse there. My grandmother actually was a housekeeper there. And so we have community and family roots here in this community. Grew up with my aunt working across the street, and I have known Suburban almost my entire life. I never would have thought in a million years growing up, being across the street, that this would be a place that I would get to come and work. It's important to me to not only be able to be a part of this community, and I've moved here now with my family, my husband, Doug, who is a health economist. He works for a health insurance payer company, but also my 2 children, twins, Isaac and Vivian. They are 7 years old and just started school here locally. We're proud to live in this community, and we're proud to be at this hospital because, as I shared, I've not only known it my whole life, I have family members that to this day receive care here. In fact, my very first week of working for the system, I had the opportunity, if you will, to be a patient myself. I had a bit of an allergic reaction that brought me into our emergency department. And it's not often that a leader gets to be an undercover CEO, so to speak, and experience care themselves. But I had that unique opportunity to experience it in my first week where many people didn't know even know who I was. I got to experience firsthand what all of you probably know from having lived in this community for many years, for having received and experienced services here, that this hospital not only provides amazing, complex care, they provide it with compassion and skill. That's what I experienced in my visit, and I regrettably and fortunately had the opportunity to validate it one more time this past weekend, bringing my own uncle in for care here into our emergency department. Again, this is not just about being part of an incredible hospital that I have known my whole life, that has really delivered on the promise of medicine for our community and has been advantaged by the incredible relationships with Johns Hopkins Medicine, with the NIH across the street, with Walter Reed. We have incredible talent right here and the ability to bring complex care now and in the future to this community. That is what brought me here. That is why I'm proud to be here. That's why I'm proud to have roots here in this community. And I am really excited about what's ahead for all of us. In my first 6 months, my goals were to be on a listening tour, to understand not only from our frontline team members, from our managers, from our clinicians, both those that are part of our community and employed faculty, physicians, but also from many of you, members of our board, members of our foundation, members of our community at large, and our patients, those that we serve. I have heard what's going well. We are proud of our CT surgery program. We are proud of the oncology care that we provide here, of our stroke, neuro, STEMI programs, being a level 2 trauma center, the only one here in Montgomery County. We are proud that we have so many staff members that have been here for the longevity of their career. In fact, tomorrow I will be attending a retirement ceremony for one of our team members that's been here for over 50 years. We have length of skill and dedication here that sets us apart, and we look forward to building upon that. I've also heard from many of our colleagues and our community members an eye for looking forward. What is next? How do we build upon what got us here, what has made us a proud member of this community? And that's by building and continuing to build on our complex services, our CT surgery program, growing our ability to deliver comprehensive stroke care, thrombectomy, on building upon our promise with surgical oncology and oncology in general, and our ability to provide for our growing and aging population. I've also charged our team to think forward and think about how we continue to invest in our workforce, how we build and train talent, not just our frontline caregivers and our providers who bring incredible expertise, but also our support teams and essential services teams. How do we continue to be a vested member of this business community and the economic fabric of Montgomery County and Suburban Hospital and the Bethesda community by creating job opportunities that invest and develop the future? And lastly, how do we continue to invest and support our core? So how do we make sure that our facilities, our services that are of general hospital nature, but incredibly important, even more so many times than our complex services, such as the emergency department, our behavioral health, our inpatient general medicine teams. So we are looking forward to partnering with you to understand how we can continue to serve this community, but how we can also honor what has made you proud to be a partner to Suburban. So thank you for your time this evening. Thank you for getting to know me. I am proud to be here. And as Cindy shared, I look forward to leveraging not only my hometown roots and my hometown understanding, but my years of experience coming not only from Centera, where I served as our chief operating officer in the Hampton Roads area, but also at Duke for 15 years in a number of administrative executive roles, including emergency services and med-surg critical care. We have incredible talent here, and I look forward to continuing to meet all of you in the weeks and months to come, hopefully not years. So if you're here and you're stopping in to see Cindy, I hope we'll get a chance to meet in person. Without further ado, I do want to turn over to Dr. Qasba, one of our experts here and one of the incredible clinicians that I've had the opportunity to partner with and meet, who will walk us through our state of Suburban as it relates to COVID. Thank you.
Thank you, Jessica, for that introduction, and thank you to my colleagues, especially Dr. Bone, who is going to tag team with me tonight. I'm very honored to be here again. This is my third time presenting in a different sort of fashion, I would say, today than before. So thank you all for allowing me to present and giving me your time this evening. I hope everyone can hear me okay. So I'm going to go ahead with the first slide. Great, thank you. So really what I wanted to sort of title this is where we are with COVID at this point. And I think where we are is very different than maybe many of the areas in the United States, as you've seen in the news. Next slide. This is a slide that you may have seen in the past. I think this is a really important slide. I think, you know, when you think of COVID or taking care of patients in the hospital, you often think of maybe the four categories on the bottom there, which is your doctors, PAs, NPs, nurses, techs, pharmacy, and laboratory personnel. But really, it is beyond that. And so the orange areas are all sort of the areas that I could think of that come to mind that have been very critical. And these are also a part of our team here, and they're the hidden heroes. They're the folks that many people don't recognize. As an example, environmental services, very critical to making sure our hospital stays clean, especially during COVID and for any other sort of infectious prevention. I'm just going to highlight a couple others. Transport to get our patients from one place to the other, especially during COVID-19, they were fantastic about being able to protect themselves and take care of these patients and make sure they get to where they have to be for their studies. Next slide. So this is just now in the past we had sort of units, floors, biomode units, and now that given our numbers being so low as they are compared to the rest of the country, we have what we call rooms on different floors of the hospital. And Leanne is exceptional at speaking to this, so I am going to do the best to be able to speak as she does to this. So we have 4 currently rooms on 4 different floors. So we have 16 total beds that can house or care for COVID patients. 8 are on the ICU and IMC level care, and 8 are on the medical floor. And so we've did this because at the end of the day, we really have to take care of patients that don't have COVID, because there's sort of been a backlog, I would say, and you probably have seen that on the news, of people who have not had surgeries, who have not come in for illnesses that really need care. So I think this was actually a very sort of logical way of doing things so that we can really manage all patients and manage them safely and make sure our staff stay safe. So nationally, what are we seeing? We're seeing a large unvaccinated population in the hospital. We're seeing also an uptick in children. 25% of our admissions are kids. And then we're seeing those breakthrough infections, which is a smaller percentage of what we're seeing. Here at Suburban, we're seeing a large unvaccinated patient population. We're seeing several transfers from other facilities within Hopkins and several outside the Hopkins system. We are seeing vaccinated asymptomatic breakthrough. So a patient comes in for a fracture or something and tests positive, completely asymptomatic. And then we're seeing a smaller percentage of patients who are vaccinated, who are having some symptoms, but they are coming in because they have some comorbidities that sort of allows their immune system to be immunosuppressed. Next slide, please. So this is a slide you may have seen, and I really like this slide because I like to really sort of brag about what Suburban has done, and I call it Suburban Hospital First. So I'm very proud of what we did here at Suburban. It took the entire hospital to do this. So if you could there are actually bullets, thank you. So the first, we actually admitted the first patient within the Hopkins system. We were able to be the first hospital in the Hopkins system, county and state, to implement the concept of cohorting hospitalized patients, which we did at the beginning. We also were the first hospital within the Hopkins system to start and to implement stat testing, so 45-minute PCR turnaround, which was incredible. That was April 1st. I'll never forget that, April Fool's Day, but it was real, right? So we were able to house our patients properly in the ER, on the floor, and really protect the staff, because it was very critical for all of us to stay safe throughout the worst of the pandemic. And then we were also able to help with NIH clinical trials, and also for the better of the patients, we were able to transfer patients. We're one of the first in the county to do so. Next slide. So I'm going to switch gears to treatment options. I think a lot of people have heard me speak about how important the vaccines are. If you're not vaccinated, to be vaccinated. It's critical. It's our first line of protection. Our masks, which now we use as our second line. We're hoping that 5 to 11-year-olds will likely be EUA'd later this year, which will be phenomenal because we are seeing an uptick in kids. A lot of the children's hospitals have seen these patients predominantly who have the MIS syndrome and who have unfortunately had to be intubated, and some of them have been on ECMO. The next category is, what are we doing for inpatients at this time? Remdesivir and dexamethasone are still our leading treatment options. Tocilizumab, an IL-6 inhibitor, is being used, but not as much. Well, there's really a sort of a growth in our outpatient management. So MAB is the monoclonal antibody. That's actually being given to exposed patients, not even that you're positive, but you've had a significant exposure meeting criteria to prevent further disease and hospitalization. If you tested positive for COVID, you can also receive the monoclonal antibody if you meet criteria. And the other thing is, greater than the age of 12 can receive the monoclonal antibody, which is a huge game changer, as we saw in the past. More to come. We know that boosters for the Pfizer has been EUA'd. Moderna should be done by the end of this month, and J&J is trying to fast track as well. And the concept of this is, I think, if we think about the flu vaccine, we get the flu vaccine annually, right? We got the COVID vaccine in, to some of us, December, January. That's not going to last a lifetime. It's going to last a certain period of time, and we know the serologies wane after some point. So it's important to get boosters to protect ourselves. Again, vaccines are our first line of defense. Masks are critical as our second line. Next slide, please. So community support. I can't begin to tell you how amazing the community is. I myself, born and raised down the street from this hospital. I frequented it myself as a kid with fractures, falling off my bicycle. This is really home for me, but it's really amazing what the community was able to do for us throughout the pandemic, and has continued to support us. Next slide, please. I'm going to switch gears now. And I think for us here at Suburban in our catchment area of the hospital, we have been very, very lucky because we're vaccinated. We are not as others hospitals as you see in the South. They're recovering now, but they were really just at a point where they couldn't even, there were people outside being treated. It was terrible. And that was really secondary to lack of vaccination. So we have been very lucky and fortunate to have very low numbers in the hospital because of this. So that's been just an absolute godsend for us. At this point, we talked about resiliency, I think, on one of our calls in the past, and that's been really critical. And I think at this point, we're really trying to sort of figure out where we are. How can we sort of heal from what's been going on? How can we move forward? And the Resiliency Center that was developed here at Suburban, and I do thank the foundation for helping with this, has been fantastic. It's been a place of peace. It's been a place of healing. It's been a place that we could comfort ourselves in the worst of times when we're taking care of patients. So that has been a huge asset to our staff at Suburban. Next slide. So our medical future, what does that hold? Well, vaccinations, continued with growth in inpatient, outpatient treatment options. We heard that Merck might be having a pill that's similar to the Tamiflu, which will be fantastic, 50% decrease prevention and hospitalization, where people don't have to run around to get any infusions or treatments. This can be prescribed and taken at home based on certain criteria. Again, continue to wear your masks, 6 feet apart, hand hygiene, isolate and test yourself when you're sick. The last slide, I think, is about our personal future. And I think this is really, it's not always about medicine. I think when we talk about medicine, I think we have to really think about a person or as an individual as a whole. And if you can just slide to the next bullets, I know there are several of them. So the top one is that we have to really avoid COVID fatigue. I mean, it's fatiguing. I feel like at times there's never like an end to this. But I think, as we continue to learn more about the disease, as we learn about the importance and encouraging larger than what we have right now in terms of people vaccinated will be very critical. I think it's really important during these times to be kind to each other, take care of each other, take care of yourself. What people are going through a lot with the significant isolation that's happened during this pandemic. Next bullet, and the last one. And I think one other thing that, I think as a pediatrician and as an internist as well, I feel like learning to socialize again may be challenging for some. I think in particular, I see in the pediatric year, I see a significant amount of pediatric patients, adolescents in particular, who are really having a hard time. Some of them don't want to go back to school. And it's been a real challenge for some of these kids to go back to school and socialize again. So, I think that's something that we have to think about in the future, how we don't have the answers about how to do, but to think about how we can, help that particular population and the elderly. As it is, the elderly, are limited in terms of what they can do, in terms of where they can go. And it's been sometimes a struggle for several, for people that are in the older age population to be able to go anywhere. They've been more secluded and isolated than they already have been. So these are things that we should think about in the future, how we can help, people re-socialize again. I don't have the answer. I don't know how, but these are sort of things that we should probably think about. And then the other thing is be prepared for future pandemics. I always say we have to be ready. And I think that's really important to keep in mind. So I just wanted to thank you again for the opportunity tonight. I'll pass it on to Dr. Bone, who is an excellent colleague, fantastic psychiatrist, and I'm honored to be here with her and Jessica tonight. And this is just the kind of to make you laugh at the end about sort of what the pandemic has done. But thank you all.
Thank you so much, Dr. Qasba. I am making the assumption I'm just going to go ahead and start talking. Lovely. I really am honored to be here as well this evening. And Dr. Qasba and I have worked very closely in the hospital on a number of issues, both on the hospital side and the emergency department. And I feel like this is perfect timing to be having these kinds of discussions. I'm actually here to talk about several things. I could talk forever, so I'm going to try and just keep it concise. But we've already talked about, there may be a number of questions and there may be a part 2. So we're going to do the best we can. And if I could just have the slides, I just have a few slides just to keep me on point, because like I said, I could be long-winded. Next slide. Thank you. So I thought I would talk about just a few different populations that have, I feel like everyone has been affected by the pandemic, but people have been affected in very different ways. And I felt like it was important to sort of try and tease out the different ways that mental health has been affected in the community, but at the same time, understanding that there are several overlapping populations, that, people aren't just in a silo. There may be individuals that cross all 3 of these different categories. I don't like putting people in any one box or label, but I do want to talk about kind of the 3 distinct categories that I could think of when thinking about mental illness and just behavioral health issues related to the pandemic. Kind of going into the pandemic, there were people that previously already had mental illness that we knew of. And I don't know how much you all are aware, but in the state of Maryland, there are no long-term inpatient psychiatric units. So chronically mentally ill individuals had to get some kind of intensive outpatient wraparound services. They sometimes require frequent, short inpatient psychiatric admissions, but the only long-term psychiatric hospitalizations in the state of Maryland currently are forensic institutions. So what that means is that a lot of these individuals rely on very heavy community resources to keep them stable. So a number of these programs are daily programs that people would go to during the day, during weekdays, either every day or multiple days a week. When the pandemic hit, all those programs closed, done. I shouldn't say all. We were able to maintain our partial hospitalization program here at Suburban, but we had to close our intensive outpatient program. And the number fell drastically because we had to socially distance everyone. We were the only program that I'm aware of in the community that did stay in person for a lot of our population. Virtual is just, it's just not going to cut it. And you really need people who are engaged and in person and able to interact with people in person, as opposed to just being distracted by, the cat or whatever's in the background. But there was a significant decrease in these programs initially. Some of them closed, some of them went virtual. Initially, ours was the only one that was still in person. We went from an average number of individuals in our program, 20 to 25, down to 6. So the wait for our program went from weeks to months to now you're no longer able to get on a list because the wait is so long. So access to day programs for people with severe mental illness became very, very difficult. A lot of the typical appointments, just regular therapy appointments or outpatient psychiatric appointments, they all went virtual. I don't really know too many outpatient mental health providers that saw people in person in the beginning, and even now. Some of them have opened up a little bit, but it's been scarce. A lot of the private providers aren't necessarily seeing people in person. And as I mentioned before, a lot of the virtual visits are really hard to connect with people and to really get a sense of what's going on with someone. The other thing that I noticed just personally is that I couldn't help myself. I do have, I'm not supposed to let this be known. And of course I'm saying this publicly now, but I do have an outpatient that I couldn't stop following when I left my last job. And I saw her virtually, and her boyfriend was in the background. I had no idea. Just seeing people virtually is just so complicated because she couldn't even talk to me, had to reschedule the appointment, and I had no idea what was going on. And come to find out, she's breaking up with her boyfriend and he was in the room. So really having virtual visits for mental health is really difficult and challenging. And you have a hard time reading cues virtually. Inpatient psychiatric units have been totally overwhelmed. So a couple of things that have happened during the pandemic is that A lot of the hospitals tried to develop different precautions to, I mean, the biggest alarming thing is on inpatient psychiatric units, we kind of allow people to mingle and eat together and socialize together. And from my vantage point, my biggest fear was, oh my gosh, let me not have a COVID outbreak on my unit. I mean, that's the last thing that we wanted, you know? So we included people like Dr. Qasba and various other experts in infection control. And really it was, we had to close a lot of beds. You know, we had to decrease the numbers of people that we were admitting on inpatient psychiatric units. And that was across the state of Maryland, across the nation, numbers of inpatient psychiatric beds, while already low, went even lower with restrictions on trying to have people having more space. That then crowded emergency rooms. And what has happened and what we're seeing is that there have been different waves. So I think initially the wave was, don't go to the hospital, you're going to get COVID. You know, and so people waited and waited and waited. So then we started seeing people really sick and they were coming in, and where you might have kind of caught them initially, like as they were starting to go down, now you were seeing them in full-blown crisis, where they were requiring longer hospitalizations. They might not even have been agreeable to taking medication, so it took even longer to get them well. And we're seeing people right now waiting in the emergency room 4-5 days to get admitted to an inpatient psychiatric unit. That's really been difficult. So that's for people with existing mental illness. So it's been very stressful for folks who already had known mental health issues. Next slide. The next area is addictions. And again, it's not like there's just one silo and then the other. There's a lot of overlap sometimes. We've noticed addiction rates during the pandemic have just skyrocketed. Individuals who already had a problem, they're more isolated. The community of 12-step programs like Alcoholics Anonymous and Narcotics Anonymous, they were great about going virtual. And I got to tell you, some people said, I'm not doing that. And people just stopped going to a place where they were getting support and getting kind of recovery and seeing people, even if it was virtually. So there's been a significant escalation in usages. There's been approximately, I believe, a 25% increase in overdoses, specifically for opioids in Montgomery County. We've had to see what we can do about mitigating that. The programs that are often offered for people with addiction, there's usually a spectrum of services. So there's regular outpatient, and then there's intensive outpatient where someone might go several times a week. And then there's rehab, which is essentially you're at a place for approximately a month, maybe even 2 months sometimes. And so the intensive services also went virtual. Our addiction treatment center, they stayed in person. We really feel like seeing people in person is so incredibly important. But again, the numbers just dwindled as far as how many we could manage with socially distancing people in person. So that the program kind of diminished a bit. But it was in high demand and very long waits for it. And in addition to that, the different inpatient rehab facilities in the area, there have been long waits to get into those because there's so much excessive usage. And then there'd be outbreaks at different rehab facilities. So they'd close for 10 days to 2 weeks at a time. So there's been a lot of issues with addiction. I think some was pre-existing addiction. I think for some people, they probably never had a problem. And I don't know if they would have had a problem, but now they do. And so they really need to get help to kind of get back to functioning. A lot of people working from home, very little structure. I'm going to have a cocktail. Oh, it's not noon. That's okay. I'm going to have another cocktail, and so without even really realizing it, developing a bit of an issue where there really wasn't one already. Next slide. So then Gen Pop, I like to call it Gen Pop. As far as like the quote, regular, normal people. And I got to tell you, I don't know who those people are. But for the average Joe that has really no real issues, pandemic hits. There have been stress for everybody during this pandemic. There have been stress with relationships. Dr. Qasba mentioned this a little bit, but she was talking about our older population. I've seen so many individuals around my age who have older parents who maybe those parents have cognitive issues and they needed more intensive care. they needed kind of long-term care or like a rehab facility or some kind of nursing facility. And individuals were not sending family members there during COVID because, wow, are you sending them for a death sentence? People were terrified to send their family members to long-term care facilities or rehab facilities and things like that. And so what was happening is that we would see people with progressively declining dementia who were becoming agitated, where their family members were trying to manage them at home and they really couldn't manage them. And then they're coming in and it's a crisis because no one knows what to do. We're seeing it with the young population. So I don't know, I have no idea the exact demographic of who is on this call. I have 3 young children. I have an 8, a 5, and a 3-year-old. And I'm sure many of you on the line have children, maybe not all. My husband works from home. He worked from home during this pandemic anyway. I had to come to work. When a kid is nagging at you while you're on a work call and they want their iPad and they want their iPad and they want their iPad and they start yelling and screaming at you and you give them the iPad, you have now rewarded bad behavior. And for a lot of people who were in that situation where they were working from home and trying to manage and crisis manage, you can't crisis manage for 18 months. It's exhausting. And everyone was just trying to do the best that they could. And what we're seeing in the adolescence is that we've seen bad behavior rewarded. And now we're seeing kids out of control, not following rules, just basic rules. You're putting them back in school in a structured environment. And they're saying, oh, really? I don't think so. And they're having full on aggressive temper tantrums and being brought to our emergency room. That's no one's fault. That's just what's happened because everyone's just trying to survive, but we've seen that. We've also seen stress on romantic relationships. I love my husband. If you stick me in a room with him for long enough, we might have some conflict. I don't know if that's the case for any of you all. But, this is just natural. If you're with one person and you don't have kind of other avenues, there's going to be conflict. There's been financial strain. People have lost jobs. I've already talked about children. And then people are just like, gosh, I've never had to deal with this before. I didn't have any problems like this before. I think I need to see somebody. Maybe I should see a therapist. Then they're calling, trying to get in to see a therapist. Nobody has openings. There's months of a wait to see people. That's just for a basic therapist, let alone a psychiatrist if people actually need medication. Next slide. Sorry, I clearly have a lot to talk about. There are community resources. So I think, as I mentioned before, there are a spectrum of services, and sometimes it's hard to figure out, wait, what kind of service do I need? Who is it that I should be reaching out to? How big is this problem? Sometimes that's really hard to figure that out. There is a 24-hour crisis center where you can call them. They can talk to you by phone. You can visit them in person. You don't need an appointment. They also have a mobile crisis team that will come to your house and actually do an evaluation. And they even have some crisis beds there where people can kind of go and sort of get away for a bit. That is for adults. There's also kind of mental health and substance abuse screening for lower income individuals. That's a separate service, but it's offered by Montgomery County. There are all sorts of substance use treatment services. I don't like to say this, but it's the truth. Both substance use treatment and mental health treatment is completely based on insurance. And so people often call me and they're like, well, where should I go? Who's the best person? And in psychiatry, there's a lot of private pay individuals for people who have the financial means to do that, but 99% of the population does not. And then it's dependent on what the person's insurance is. Do they have commercial insurance? Do they have state insurance, that kind of thing? And a lot of times treatment services are based on what their insurance will cover. There are certainly intensive outpatient services that are in the same sort of vein. Suburban itself has a few services here. So we have inpatient psychiatric services here. We also do detox on an inpatient basis. Sometimes we do it on our unit. Sometimes that's on the medical unit, depending on the demands for the beds. We have a partial hospitalization program here that's very small and has, at this point, a pretty lengthy wait. And we also have an addiction treatment center that offers intensive outpatient services for substance use problems. So those are kind of the basics. I know that's a lot, but that's kind of where we're at. And as Dr. Qasba was saying, moving forward, we're trying to figure out a way to kind of get back to the norm and kind of re-socialize people and kind of get people talking and just get them working together to move forward. So I know I've talked way longer than I should, so I'm going to turn it back over to Cindy, and I'm sure there's a lot of questions. Or to Jessica, excuse me.
Cindy, as we turn it over, and I know you're unmuting, I do want to thank both Dr. Bone and Dr. Qasba. And I would also like to share, I have been so moved by our need for mental health and behavioral health in our community. We have actually partnered with an outside consultant who will be coming in to help us understand how we continue to invest our at times limited resources for the magnification of impact here for Montgomery County and the Suburban Hospital community. And that is really an attribute to Dr. Bone, her leadership as our medical director, and her bringing forward where we have some need. And I know, Dr. Qasba, you have seen that as well in your shifts in the ED with our pediatric patients. And more holistically, how we support our frontline caregivers. As you shared, regular toll in healthcare is hard. 18 months of a pandemic is harder, and returning to normal while straddling a pandemic is uncharted territory. So thank you to both of you.
Thank you so much, Jessica. Thank you for wrapping that up and also mentioning, what we have planned for strategic planning for behavioral health, because we do know that this is a great need that has really been exacerbated by this pandemic. So I'm going to go into the questions now, and thank you all so much for your presentations. And now we'll go just a little bit further with questions and answers. I'll jump around a little bit. So Dr. Qasba, if you are vaccinated and you get exposed, should you still consider getting monoclonal antibodies? Or is that just for unvaccinated people?
Yeah, that's a great question. So yeah, it's for both vaccinated and unvaccinated. Absolutely. Good question.
And I'm going to ask you a second question. I'll go to you second. So for an individual we're going to have probably a lot of questions about boosters, but for an individual who has received the Moderna vaccine, is there a way to rush out and get a Moderna booster at this point? Like, can you get in a pharmacy or your doctor's office, or is it not available yet?
Yeah, so you can do anything is the way, at this point, but I would recommend to hold off. I think the important thing is we have to remember what the safety is in terms of getting the booster, but I think Moderna will have more to come in the next month. I think the important thing to remember that the data has shown, that's why they're not rushing with Moderna, because so far the data has shown that it's effective. I think I would just sit tight. I wouldn't be going to the pharmacy to get anything quite yet. I think the other point that I want to make with that is people think they can mix and match. There's going to be data coming out on that as well. So I would hang tight.
Thank you.
Sure.
Jessica, we had a participant ask a bit about our emergency trauma center and the importance of that here at Suburban compared to some other locations, and what exactly does being a level 2 trauma center mean?
Great question. So there are 3 levels of trauma centers. We're at level 2, and I'll explain what a level 2 is, but we're actually the only trauma center of any level here in Montgomery County. So a level 1 trauma center is minimal capabilities, really focused in your emergency department in training on how to recognize and immediately stabilize and transfer out a trauma patient. A level 2 has a more robust set of capabilities at their hospital, which would include things like emergency acute care surgery, general surgery, your cardiovascular surgery, vascular surgery, neurosurgery. So we have robust capability where we can provide definitive treatment for most traumas that come through our door. So we can stabilize you, we can admit you, we can treat you, we can intervene, we can do surgery. Where we then partner though is with a level 1 center like Johns Hopkins main campus. that has the ability to treat a higher volume of patients. So when you think of a large mass casualty, we have preparations and capability to support that here, but we would also send our highest acuity to a level 1 center so we could treat more in our community here. Secondary to that, they may have greater depth of beds and resources. So being a 222 bed hospital, we may transfer out some patients of higher complexity to make sure we can continue to treat incoming volumes. But a level 2 center is known as definitive care. We provide excellent, robust, high level care. And it's really very specific complex surgery, like maybe microvascular or micro hand surgery or plastics that we might send out. So that's a pretty good example.
Thank you so much. Dr. Bone, question, can a COVID infection actually lead to a neurological condition that may present as a mental health issue? In other words, not just the stress or the pressure, but can the illness itself actually cause a mental health issue?
I feel like that's a cross question between Dr. Qasba and myself. What I will say, what my experience has been so far is I have seen families want that to be the case. It would make a lot more sense if COVID caused this problem. And what I've seen is I have seen young individuals, late teens, early 20s, who have come in psychiatrically unwell, and they had COVID. And I do think it makes sense to think that, well, maybe COVID caused this, when really it's when mental illness tends to present itself. So I think it's hard to wrap your mind around when an individual was well, and then really most mood disorders or even psychotic disorders present late teens, early 20s. And so if you had an individual that was well, they had COVID, and then they had some kind of break, I think people want to believe that there's a relationship there. I have not found there to be a relationship there. But there are neurologic issues. So Dr. Qasba might want to talk about the neurologic issues.
Yeah, so you can see COVID encephalopathy, which we have seen. I actually saw a recent case. It was unbelievable. Completely healthy person, played pickleball, tennis, like every day of the week, and was vaccinated and got exposed. Him and his wife were both positive, and he came in very encephalopathic. He is slowly recovering. We treated him, but so you can see true neurological, I guess you could say, disorders from COVID.
Thank you very much. I hope that answered the question. Let's see, Dr. Qasba, is it safe to travel? And would you?
Okay, so this is my response always during COVID. I think we have to learn to live our lives, but safely during COVID. I think it's really important for our mental peace of mind, our being able to live, to be able to travel. Now, there are restrictions in terms of countries that I would not be keen on traveling to. Would I personally travel? I think I would, but I would make sure that most of my activities wherever I go is outdoors. And I would, be cautious about where you're going to travel, how you're going to travel, who you're going to be around when you arrive, and to what area you're going to travel to. I don't know if that helps, but
that does help. Thank you. And I'll just give you a moment to hit your top 3 of the precautions that you want to make sure people put in place before they do anything.
Yeah, so I think make sure you're vaccinated, number 1, fully vaccinated. That means 2 weeks out after your second shot, a Moderna or Pfizer, and J&J is 2 weeks out of your first, number 1. Number 2, make sure you are masked when you get on the plane, throughout your travel. Hand hygiene. It's hard to be 6 feet apart when you're sitting on top of someone, I think, on the plane almost. Hotels are actually okay. Make sure you're masked up until your room, and try and do as much as you can outside, and avoid being around people in close quarters.
You know, Dr.
you.
Qasba, to this day, one of the largest presentations that we're seeing with people with COVID are where people take down their guard and their mask around close friends and family. And so we still remind and caution folks, you know, we want to see family, we want to be close to folks, we want to eat with them, but we still have to remember to have our guards up for gatherings.
Yeah, so I think Jessica, you make a very good point. A lot of people I know who have decided to travel said, oh, I just had one meal with a bunch of people that was indoors. And then one person tested positive and then everyone was positive. So I think you have to be really like careful, you know, about, as you mentioned, about, you know, letting your guard down and taking your mask off and in what settings. I think it's okay to eat outside. I think I would say, like I said, you have to learn to live your life during COVID. But safely.
I'll step off of that actually with a couple of other questions here. Two questions for you, Dr. Qasba. Do you envision boosters in the future, like flu and COVID combined? And then the second question is, do you think we'll see a time with no COVID, or does COVID now become almost like flu?
Yeah, so I think so good questions. I think COVID may enter our world like flu is. I don't see that they're combining the vaccines just because the technology is different. But I do envision that we'll be perhaps looking towards getting annual COVID vaccines, just like we get the flu vaccine. I just hope a lot more people get the COVID vaccine, like people do run to get the flu vaccine annually. So I'm hoping that that will be the case moving forward. Do I see a zero COVID in the future? No, I don't.
Thank you. Okay, let's see. For Dr. Bone, what age group or population of those that you discussed are you most concerned about for mental health going forward?
From 0 to 110 years old. I mean, so honestly, really everyone. I mean, I'm concerned about I'm concerned about the healthy population, staying healthy, remaining highly functional. I'm concerned about that population. I'm concerned about the severely mentally ill population who's not getting the care that they need. I'm really worried about the kids who it's getting hard. I'm worried about the geriatrics. So it really is 0 to 110. I'm really worried about everyone.
Do you think you could give us just a couple of, you know, for individuals who are not necessarily going to seek therapy or psychiatric care or medication, you know, what are some of those just really good reminders for people in terms of keeping their mental health, in terms of staying mentally healthy, that you could recommend to some people?
So I think that there are sort of top things for self-care that are true for anyone in the population. I think good sleep is really important. I think that eating nutritious food is very important. I think exercise is very important. I think all three of those things are really important. I think trying to establish interactions with other people in a safe fashion is very important. And I do think that I'm a really candid individual, and I think some people hold things really tight. And I just wish that we could support one another because everyone is suffering in some way. And you know, I know that I want there to be hope in this. I mean, there is. I mean, I actually am. I'm very excited that we're going to come up with a strategic plan for how to really bulk up behavioral health services that are much needed in this area, and how to try and, you know, help individuals in the community re-socialize and reintegrate into the world. But I think just the basics are good for stress reduction. I'm all for just YouTubing a guided meditation. You know, I mean, just basic things to help us settle down and to remain healthy are most important.
Those are really good points. Thank you so much. I really do think that that's so important to remind people. And then also, like you just mentioned, and like Jessica mentioned, you know, Suburban and many other institutions probably will be really looking to the future of what we can do to help support mental health and behavioral health in our communities. I know we're starting to run a little bit tight on time, and Jessica, we have a great question on here that was put out here by one of our participants. Can you tell us a little bit how the new wing at Suburban Hospital has been integrated into the overall hospital, and how that's been a benefit for us?
So it has been an incredible benefit. The new wing opened prior to me arriving here, but I understand that it opened just in time for us to begin receiving COVID patients. So for those familiar with our hospital, prior to the new wing opening, we had a number of rooms here that were semi-private or shared spaces. Obviously, in a pandemic and highly infectious disease event, you want to have a private room, not only for your safety, but as we think about comfort and how we deliver care going forward, that is the model of care delivery that we were moving towards. So we're very fortunate that the new wing and tower opened right at the beginning of COVID. It is fully integrated into our full care and operations. Our new ORs are integrated, hybrid ORs and cath labs are there on the bottom floor. And so they provide an integrated experience for our surgical units and ICUs. And then horizontally, we've integrated those units with still having some units in our pre-existing tower. And so we are very excited that it's here. It has provided immediate benefit to our staff, to our patients and community. And next up is fully integrating a piece that's not fully complete, and that is our medical office building that we are very excited to begin planning for. There are a number of, again, programs and services that we look to further enhance and develop here in our community that we hope will build homes here on our campus in that building so that we have care right here close to the building for our complex patients.
Thank you so much. Yeah, it's really exciting what we have going on there, and that the opening of that building, the new clinical building just before COVID was really, really incredible for the care that we were able to provide for our community. I know that. So for community members who would like to make a donation, what would you say at the moment is one of our greatest critical needs?
That is a great question. And honestly, it becomes at times hard to prioritize, but I will end with the 3 priorities that I shared at the beginning. Number 1, for those that are so moved to continue to invest in the growth of our complex critical services here, there's opportunity to grow those programs, whether it's cardiac surgery, neurosurgery, or oncology care. There is need and plans that are coming forward. For those that are moved to support the commitment and development of our talent, and that includes not only building clinical capability, training programs, and building our workforce, there is need there. And third, how we continue to invest in our infrastructure and core services. The emergency department is one that comes top of mind for me. We have a beautiful new wing, a beautiful brand new OR, incredible care here, but our emergency department is a little bit more aged, and our team there has made incredible care possible in a very tight environment. And we have grown the complexity of care that has really outgrown that environment. So one of the things that I've challenged our team to look at this year, we have brought in an architect that is going to be helping us assess that space and help us understand design plans to bring forward a full capital proposal. And I imagine if there is desire and commitment from members of our community to invest in that vision with us, there will be need and priority there. And that supports all of our missions as a critical care provider, complex care provider, behavioral health, pediatrics. So a great place to support need.
Thank you so much. That's such a great place to end. And so I will end there. But I will end by saying thank you so much, first of all, to everyone who joined us for this webinar. We really love to do this, and we will bring another one to you as soon as we possibly can. As you could tell from Dr. Bone, there's lots more to talk about, so we'll continue that. To thank Jessica and Dr. Bone and Dr. Qasba and everyone who joined us, we're very grateful for your time and for your expertise. And we appreciate you giving this opportunity to help us inform our community. So we're here. If there are further questions, please don't hesitate to reach out to the foundation office and we'll get those questions answered. And I hope that everyone has a wonderful night and stay safe and wear your mask and wash your hands. Okay. Thank you so much for joining us.
Thank you, everybody.